once again for joining me. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today we continue our series of discussions around the COVID-19 pandemic. The show is called Your Doctor and COVID, and remember, if you have any questions that you would like to communicate with us, kindly send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Today, as usual, I'm wearing my mask covering both my nose and mouth, and I will now take them off so that we could continue our conversations and understand each other a little better. So we continue to see the effects of COVID-19 in our population. Every day we have cases that are positive, and we are having persons dying who have tested positive for COVID-19. So we wanted to continue answer your questions, and we would hope that this continues to be of interest to you, that you continue to send them to us as they arise. So here is the first scenario and question that came in earlier this week. My mother was admitted to hospital with shortness of breath. They tested her and put her to be with suspected COVID patients. The results came back 4 days later, and it was positive. Here are the questions. Could she have gotten COVID-19 from another person in the hospital where she was kept? And what kind of treatment would she get in hospital? Now, earlier in the pandemic, there was quite a significant backlog of results after testing. And so therefore, persons would have had to wait long times for them to receive their results after testing. And so 4 days was not unusual. I believe there were some patients who had to wait at about 7 or 8 days even after tests to get their results. But here is someone who came into hospital, was tested on day 1, results came back on day 4, and it was positive. In the meantime, they were kept with other persons who were suspected to be COVID-19 positive. And there are some important questions asked. Could she have gotten it from those whom she was around in the hospital, and what treatment would she get in hospital? Now, it can take up to 14 days from the time of exposure for someone to test positive. So let's assume that you get exposed day 1. If someone gets tested on day 3 after getting exposed, then even if the results take 2 days to come back, it doesn't matter how long it takes. At day 3, the results are likely to be negative. However, if they develop symptoms later on and they test like around day 10 or so after the symptoms would have started, that's the optimal time. Actually, the time is between day 7 to day 9 when you are more likely to be positive if you actually have the virus. So testing before that time will show negative. COVID-19 has a specifically well-defined incubation period and timeline. So let's look at someone, let's assume the name Sally, okay? And let's say Sally was exposed to a positive person on day 0 or day 1. 5 days after, Sally decided to go get tests because that person results now come back and Sally is worried. So she spent an hour or so with this person on day 1. If Sally tests on day 5, her results will come back negative. She'll feel very reassured and then enter back into society, continue to going to family get-together, back to work, etc. But by the time day 10, when symptoms start, if she was to test again, that is when she will see the actual positive results. So if you have somebody coming into hospital and they are testing positive from a sample taken when they come into hospital. They did not get it in hospital on day one. They would have been infected for at least a week before they actually reach hospital. That's just the science. It is not, it's not an arbitrary thing. It is what is known of the virus from the time someone comes in contact with it, the incubation period, and when a sufficient viral load is reached in the body for it to be detected by standard RNA testing. So if you were to look at the graphs as they exist scientifically for the virus itself and the development of antibodies. Remember, the testing that we're talking about so far is RNA, the specific test. So if it's positive, it means you have it, okay? The antibodies are quite different. Antibodies are your own defense mechanism against the virus, and that only starts to show up positive after the first week, and it can persist for much longer, but it does not necessarily mean that you actually have the virus. It means you have been exposed to the virus and you have mounted a response. So if you look at the timeline graphs again for the viral particle, from day 0 to day 7, this is called the window period, and this is usually when persons have no symptoms whatsoever. The viral load in the body will continue to rise. It reaches a detectable level after 7 days. It can peak about 2 weeks, and then after that 2 weeks, it starts to fall again, and up to about a month or 28 days later, it stays in the body and then disappears. So during that time, your body then starts to fight against this virus. It starts to produce its own soldiers or antibodies. The first type of soldiers or antibody is called the IgM or immunoglobulin M, and it starts to occur around day 7. It peaks just about 2 weeks, and by day 21 it disappears. Now, these are some of the antibodies that can be detected in the rapid testing. A second type of antibody, the IgG or immunoglobulin G, starts to be produced in the body around the 2nd week, and it rises and gets to a peak between week 3 and 4 and can persist for much longer. And again, this is also a part of the rapid antibody testing that is available sometimes. So we see there that there are many days, at least a week, between infection to the time in which you could actually pick up the virus by normal testing in the body. So to summarize the answer for the first question, could this have been due to hospital exposure? It is very unlikely for exposure to happen at the same day the patient becomes positive. It's very unlikely. The virus does not act that quickly. It is more likely that this person would have been exposed before getting to hospital. And it is important to follow basic guidelines so that you do not reach hospital. These are things like wearing your mask, wash and sanitize hands and surfaces especially, and of course practicing social distancing when in public. When in hospital, there are two main approaches, or even at home. The main approach is by providing supportive care. And what really is supportive care? Well, we will look at that. But to date, we need supportive care because there are no recommended specific medications to prevent or treat the new coronavirus. What we do have now coming out of recent research is that we have vaccines, but those will be in production very soon to reach the numbers that we could actually have some in Guyana to treat our vulnerable or use for prevention in our vulnerable population. Those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. What really is involved here are things, basic things: proper nutrition, hydration, fever reduction, treating pains, aches, etc. So supportive care is the treatment that is given to prevent, control, or relieve complications and side effects, and to improve the patient's comfort and quality of life. So it is important, and we can all provide quality of care at home for our friends, our family, ourselves. Simple things, like if you have a fever, the thing that we normally use routinely, people use Panadol, acetaminophen, Tylenol in any preparation, whether it's tablets, liquid form, or dissolvable or chewable. These are all possible things that you can do as part of supportive care. Remember to stay hydrated. We love to have chicken soup or some kind of soup when we're sick. There is nothing wrong with that. Supportive care also includes building your immune system by using lots of vitamins, especially vitamin C, vitamin D3, and zinc as well. There's also some credible claims that using lots of garlic and ginger and turmeric also help to boost and build your immune system. I have absolutely nothing against that kind of approach, and would actually encourage that once you can eat and drink, that you eat and drink the right things, or things that are known to be able to help boost your immune system. In terms of specific treatment in hospital, remember, there are no specific silver bullets, no cure for COVID-19 that we have so far. But here in Guyana, we have a number of things that we have tried and we have used, just like the rest of the world, as we try to find the right combination to treat our patients. And we look at basic things that have been around for quite a while. Convalescent plasma is used, and we have used it extensively as one of the first places in CARICOM to employ this strategy. Convalescent plasma essentially is taking blood and blood product from a recovered COVID-19 patient. We process it, make sure that it's pure, and then we give it to a sick patient who has COVID-19. What we are hoping for that strategy is that there's enough antibodies or soldiers in the recovered patient's blood that we can give it to a sick patient, and it would help fight off their infection. We have had fair success, and it is a strategy that we continue to employ at the Georgetown Public Hospital. Specific medications that we use include things like steroids, antibiotics, the antiviral remdesivir, the antiparasitic ivermectin, hydroxychloroquine, and other anti-parasitic medication. We have pulled back somewhat on that as better options become available. And of course, the supportive care continues to happen in hospital using things like vitamin C, zinc, and vitamin D3 as well. So these are all things that we have available in Guyana, and we utilize in order to try and treat our patients to the best of our abilities. Specifically, let us look at a cheap, readily, easily available drug called dexamethasone. This is one of the steroids that has shown itself to be of significant benefit in treating patients who have COVID-19 infection. Low-cost dexamethasone reduces death by up to 1/3 in hospitalized patients with severe respiratory complications of COVID-19. That's information that is coming out of the UK, in fact from Oxford University, after extensive trial. And so we have used that as well as the rest of the world to try and reduce our death rate and our mortality rate from this COVID-19 infection. Low dose of dexamethasone has been tested, and it has been shown to be effective. Recovery trials were conducted by Oxford University, and it is the first drug to show a fall in deaths for patients on ventilator and oxygen support. Dexamethasone reduced death by 1/3 in ventilator patients and 1/5 by those on oxygen support alone. There is, however, no benefit seen on patients who did not need respiratory support. Is dexamethasone suitable for every COVID patient? We need to reserve dexamethasone for critically ill patients with COVID-19. This study conducted in the UK found that dexamethasone reduced the mortality for COVID-19 patients who required oxygen support. It should not be stockpiled or used for mild COVID-19 disease. There is no evidence for this type of use, and the drug has, like every other drug, significant side effects that need to be monitored and should be given under medical supervision. So I thank you very much for joining me again. Remember, if you have questions related to COVID-19, please feel free to send a WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you very much again.